Joe. How are you? Great to see you again.
It's good to see you too, Fraser. I know we just saw each other at a conference, but it's a different feeling when we get together to talk about Tallahassee. So it's good to see you.
It is, yeah, and as you know, this is our latest recording where we focus on three healthcare issues that our physician members need to know about from Tallahassee, and it's the end of June. Session's finally over, but that also means July 1st is tomorrow, actually. So all these new laws that were included in the bills passed here in Tallahassee, many of them take effect tomorrow. So it's timely for us to get back together here and chat about what laws are going to be implemented starting tomorrow and what our members need to know about them. So great to see you again, Joe.
Yeah, and like you said, it was kind of a different session where things got extended, but the timing all kind of makes sense. Where now we're talking about things that are really going to be happening. So again, I'll just let everyone know I'm Joe Daraskevich. I work for several medical associations and societies around the state alongside Fraser. I'll go ahead and let you, in case their first time joining us is today, tell them who you are as well.
Yeah, definitely. I'm Fraser Cobbe. I'm the executive director of a number of the same associations that Joe works with, both county medical societies and state specialty societies here around Florida. And it was great in a bit of a break we had since the last one we did this. You mentioned a couple conferences we've had a chance to go to. We've heard from people they've been enjoying this podcast series. They missed us since we haven't done one since the end of the originally scheduled session. So it's good to be back.
Right. Yeah, it's not quite the same as you're getting fan mail and stuff like that, but seeing people that are listening and tuning in, it does make us feel like we're doing something that's a benefit to the people. So it was good to see everyone that offered us our congratulations on these podcast episodes. So without further ado, let's jump right in. You want to tell them what we're going to be talking about today? I know we kind of hinted on it. We're talking about the things that are actually happening now.
Yeah, and then going along with your music theme that you already give everybody a deliverable at the end of these programs. This year's session was a long, strange trip indeed, taking a little play off the Grateful Dead there. But yeah, the session got extended through the original closure date until mid-June when they finally agreed upon a budget. So a lot of that has impacted the number of bills that passed, and therefore the number of laws that are taking effect in July tomorrow. So this will be a relatively quick podcast because there's a few things to highlight for our members, but a lot of items were left on the table up there in Tallahassee to be potentially debated when session convenes again in January.
Right. It's a cycle. So we'll keep those things but we'll keep a close eye on those. But for now, let's jump right in. We have, as we do each week, we have three sort of headlines that we're going to talk about, and like you said, these are the things that will be taking effect on July 1st. So let's jump right in. The first one, upcoming season provides testing times for student athletes. I know this is a big one for a handful of the societies we work for. So what are we talking about here?
Yeah, we've been monitoring this bill throughout session and mentioned it a couple times. The bill ultimately did pass both chambers and was signed into law just last week, I do believe, by the governor. Most of our physicians that do a lot of the back to school physicals for student athletes or our pediatricians that care for the student athletes have been watching this bill. It makes Florida rather unique. I believe the only state, and don't quote me on that, there may be one other state that's mandated ECGs for all student athletes at some point during their high school career. Obviously, trying to address the number of deaths we've had from athletes dying from undetected heart disease or other issues surrounding cardiac health for them. So it's an interesting bill. It does not actually take effect until the 2026 school year. So while it won't be in play this fall for the student athletes, the school districts need to start working with their private partners on how they're going to implement this next summer. So they do anticipate, again, screening all high school student athletes one time during their high school athletic career. So you're talking about 75,000 students each year that'll have to get screened if they divide up that bucket and then maintain it year after year. The big challenge, I think, is going to be school districts have to find a private partner to provide low-cost EKGs to the student athletes. If any school district fails in finding that below $50, then students in that school district are exempt from compliance. So the school districts will be out there working with healthcare institutions, nonprofit organizations, try to find this testing. But the follow-up issue is probably a larger concern because based on data, about 1.5 to 3% of those screenings will flare up an abnormality that needs to be followed up with. So those kids are going to need to find a cardiologist to follow up with. So you're talking about what 3% at the most of 75,000. Quite a bit of follow-up care that'll need to be arranged in the community to make sure that those student athletes can get cleared and get back on the fields. So definitely something to flag. Florida is a leader in this arena in the country, so it'll be interesting to see what sort of partnerships emerge locally to help our student athletes get through this and meet this requirement and help out the school districts as well.
Yeah, and this is one as a, I was an athlete myself in high school, and I always remember getting those sports physicals. And like you said, in general, everything, checks out just fine. But there are those cases where something is found. And so it's a very important thing to do each year. And then, like you said, since it's taking place in 2026 for that school year, that gives these county medical associations and societies a little time to maybe, develop some partnerships, figure out a way that we can make these things go smoother and kind of give back to those student athletes. So very important topic for anyone who's ever played sports, anyone who has children playing sports. So we'll keep an eye on the implementation and how we can jump in and help out with that one. So
Yeah, yeah, and
good
as you
one to kick
mentioned,
off with.
yeah, many county medical societies have worked locally throughout the years to provide these school screenings in the summer to make sure all the kids have what they need to be cleared to play. So again, I think those county societies have an opportunity here to create some partnerships locally and continue that good work they've been doing.
Yeah, and if anybody has any questions on how to get involved with things like that, reach out to Fraser or myself, and we can help connect you with some. Whether it's at the county level, whether at the state level, we can facilitate some of that. So, ready to move on to number two?
Yeah, I guess one other thought though before we go, there's a number of your children's hospitals around the state that have been at the forefront of taking care of these student athletes as well. They've been involved in FASMed and some other organizations. So they're going to be a great resource as we work through implementation with the school districts too. So they deserve to shout out as we were going down that list.
Yeah, no, and all of our partners are, we're happy to work with all the different organizations that we do. So, thank you for shouting them out. We don't want to leave anybody on the sidelines as we're talking about, sporting events and things like that.
Well played. Well played. I like that.
You like that? That was out of your playbook there. You're the wordsmith usually. All right, moving on to number two. Let's keep the ball rolling. Legislature limits non-FDA approved use of stem cells to orthopedics, wound care, and pain management. Those are some interesting topics there. What are we talking about?
Yeah, and sorry that the headline was a bit of a mouthful for you, but yeah, the state is starting to step in to look at the use of unregulated use of stem cells in the state. So again, it's really focused on non-FDA approved use of stem cells. They wanted to make sure that it was contained just to certain treatments. So as you mentioned in that title, they really have just approved it for use on orthopedics, wound care, or pain management. It doesn't specifically state what medical professionals, what specialties can use those non-FDA approved stem cells in those three buckets of treatment, if you will. But those are the only buckets that are approved. So for anybody doing non-FDA approved stem cell work out there that does not fall into one of those three domains, they need to be aware of that. Also it does talk about where stem cells are derived from and put some restrictions on where you can be harvesting your stem cells. So just something to flag for anybody that's out there doing kind of cutting edge or non-FDA approved research or work is something to just flag to know that the state of Florida is stepping in to regulate some of that.
Well, and this could this be one of those where we see them come back next session and add in new buckets, or is this kind of a starting point, or what are your thoughts on that?
Yeah, definitely. And as technology advances, right, and stem cells, they find new ways to use that too. The legislature has somewhat limited its use by putting those three definitions in the statute. So yeah, as science improves and use improves, they're probably going to have to go back and clean up some of that to make sure that some of that cutting edge work can still be done. But
Sure. So that's something we'll be talking about as we, talk to our different doctors and people like that. As we need people to come out and testify next session and things, we can reach out as need be. Anything else on that topic, or are we just ready to go on?
then let's roll on to number three.
All right, the third one. Elected officials expand disease-specific research opportunities and give schools more healthcare tools. Okay, what kind of tools are we talking about here?
Yeah, and these are important issues, but I kind of bucketed them together because again, there weren't that many major pieces of healthcare legislation that passed this year. But it's important for us to flag these things where the state is kind of expanding into areas of research assistance and what the schools can do there locally for kids. As far as research goes, they have created an Institute for Pediatric Rare Disease, which is going to be housed at FSU, my alumni, which hence I wore the FSU shirt today. There you go. Shout out to the Knowles.
Yeah.
Um, and then a second research institute specifically on Parkinson's disease. It's going to be at USF in Tampa. So two new research institutes in the state, which is kind of cool. Also, as far as the tools available for school districts as well relate to healthcare, there is some language that expands diabetes management medications that they can be carrying into school. Some expanded training also for cardiac emergencies response, as well as anaphylaxis training. So trying to make sure that officials in the school district, teachers, and other administrative folks, have training on how to use those life-saving medications and devices as well. So a good job by the legislature reaching in and making sure that folks have that training on the ground to be able to respond timely to emergencies.
Yeah, and you're talking about how these are sort of similar topics that we've been talking about, but it all kind of makes sense here. Talking in summertime, people are looking ahead to the next school year, and a lot of the things we're talking about are things that are going to be impacting the children, the teachers, the medical professionals across the state. So while you say that they're all, they're not the splashiest of headlines, they are very important and they're timely as well.
Absolutely.
All right, so we have a little bonus discussion today. I know we've already talked about our three big things. You ready to jump into what we're going to be discussing now?
Yep, absolutely.
All right, bonus. Lawmakers say give patients their due, just not until January 1st. Okay,
Yeah.
that's a good little calendar item there. What do you mean by that?
Yeah, I put this in the bonus category because it doesn't actually take effect tomorrow, July 1st. It takes effect on January 1st, but it's something that's had quite a bit of chatter across the state and something our physicians and their administrators really need to know about. But the law that passed really wanted to make sure that any overpayments that physicians receive from patients, that the doctor's office goes ahead and refunds the patient those overpayments. It does not, one major piece of amendment work we did on that bill was making sure we attached it to the prompt pay process. So currently the state, has statutory provisions in there on how insurers and physicians can work together to figure out what the actual final amount to be reimbursed or owed is. So none of this will impact your restrictions around prompt pay. So you still have the ability to get into discussions with the insurance carrier, and deadlines for when you can appeal underpayments and things like that. But at the whole end of that process, once you've determined at the very end, this was the right bill, the right amount owed. If the patient has overpaid you, you have 30 days from that point that you're aware that you do have a true overpayment. You need to refund the money to that patient. So again, you got 6 months to figure out a process in-house on how to do that. There was a question asked if a credit on a patient's account would suffice, and I don't have that answer yet. We'll see how the regulators feel about that. And one final plug, it is the Board of Medicine that will regulate this. So most likely triggered with a complaint from a patient to the board that you have not returned an overpayment. So again, if you're working with your patients through those processes, making sure you're getting them reimbursed in a timely manner for their overpayments, again, this should not be a major issue, but certainly something that your staff needs to be paying attention to come
Yeah,
January 1st.
right. That's the reminder. Most of the things we're talking about today are really happening now, but this is one that is important to talk about. But you do have a little bit of time to get your ducks in a row. January 1st again is the date that will go into effect. Okay. All right. Are we done with the X's and O's? Well, we do want to tell people we're going to be getting back together a little more regularly here. What do we have for people over the next few weeks?
We will, yeah. We're planning on doing a little bit of deeper dive into some of these bills that have passed and will be taking effect. And also, we might do a deeper dive too on one of the other major things that we're not talking about today, but the wrongful death legislation that the governor vetoed. Probably do a session, just deeper dive on that one, just talk about where the state goes from here, since that's something that's on the mind of a lot of physicians as well. But I mean, one thing I will say, since session lasted so long into mid-June, and it's an early session start next year in the second week of January. They start committee meetings again in September. So their summer is quite short. So we'll be back at it very soon. So I think a couple, deeper dive podcasts between now and start of September, and then we can get right into talking about what's on the table for next year.
Yeah, and there's not much time to, catch your breath if you're, some of those doctors out there that are, talking to lawmakers and kind of, making those connections that, sometimes session ends and then it's, you kind of sit back and relax for a little while. But these legislators are going to get going pretty quickly. So if you have those connections, if you have those resources, there's not much time to take a break. We're jumping right back into it. So Fraser and I, you'll see a lot more of us on these videos, and from time to time as we do those deep dives, we could bring on some special guests. So tune in as those pop up on your email inbox or on your social media feed. We'll have more for you in the coming weeks here.
Fantastic. Yeah, and I know you're not going to leave us hanging without a musical recommendation for the week, are you, Joe?
No, no, no. And so it's been a couple months, and because session was extending, I gave the band the King Gizzard and the Lizard Wizard the last time we came on, and it was I was going to do a different genre of that same band until the session ended. So the last time I picked "Fishin' for Fishies," which is a kid's song, and it's now my daughter's favorite bath time song. She has a little fishing rod that she takes into the bath with her, and we play that song. So it's a child song. The next one I'm going to pick is also by King Gizzard and the Lizard Wizard, and this is the one that kind of put them on the map. It's called Rattlesnake, and I'm not going to spoil anything, but give it a listen. Rattlesnake by King Giz. And once you listen to it, you'll realize it was one of their earlier songs. So there aren't many lyrics. It's real catchy. It gets in your head. But they're prolific as far as putting out albums. They've put out 24 albums over 10 years or something like that. And one of our colleagues, there's a joke where I'm like, "Can you believe how many albums they put out?" And she kind of rolled her eyes like, "How do they do it?" Because the lyrics aren't very, it's not very many lyrics in this song. But give it a listen. Let me know if you like it. Rattlesnake by King Gizzard and the Lizard Wizard. A little different than Fishing for Fishies. I'll just say that.
Terrific. Thanks so much for that tip, Joe. I'll have to check out both those songs.
Oh, yeah, well, in all this
Right.
time, I thought for sure you would have already listened to Fishing for Fishies.
No, not as of yet, but I'll check it out for sure.
Okay. All right. Well, that's it for this week. It was great getting back together with you. And like you said, a lot happening over the next few months. We're going to be getting back together. But for now, let's say our goodbyes.
Yep. Thanks, Joe. This was a lot of fun again.
Yep. See you later.